Is it possible to accept yourself while simultaneously changing? Hello everyone and welcome back to my channel. Today we're going to be talking about Dialectical Behavior Therapy, or more commonly known as DBT, which is often the main type of therapy used for those with BPD. Founded on behaviorist and Zen philosophy, Marsha Linehan developed DBT in the 1980s to help treat highly suicidal clients. And the main objective of this treatment is to help clients build a life worth living. So what I mean by this is helping them determine what the dream is, what they want in their life, and what would essentially make them stay alive. So what exactly does DBT stand for? The D within this acronym stands for dialectical. This fancy philosophy term is based on the notion of a dialectic, or two things that can seem like opposites but can in fact be true at the same time. The main dialectic in DBT is trying to balance acceptance with change. Now, for example, one of the core assumptions of DBT is that everyone is doing the best that they can, but simultaneously, people need to do better, try harder, and be more motivated. The B stands for behavior. And a behavior, essentially, is anything that can be reinforced. And typically, we can increase or diminish the likelihood of behaviors happening by using reinforcements. Think of a child who is learning how to potty train. When the child feels an urge to go pee and they use the toilet and we give them candy, we're using positive reinforcement to reinforce the behavior that we want. So we want the child to be using the toilet versus them peeing in their diaper. Therefore, in DBT, clients' problems are actually described as behaviors in terms of frequency, intensity, duration, and so on, rather than symptoms. In DBT, therapists will work with their clients in order to help them increase and decrease target behaviors. So for example, decreasing self-harm while also increasing assertiveness skills. Within this domain of behaviors, we also have this concept of a wise mind. What I mean by wise mind is balancing the reasonable mind, who is ruled by logic, facts, and pragmatisms, with the emotional mind, which is ruled by feelings, moods, and urges. The wise mind, contrary to both, sees the value of both reason and emotion and is representative of this innate wisdom that each person holds within. Lastly, and most evidently, the T stands for therapy. So, what does the DBT treatment actually look like? Over the course of 6 months, those partaking in the program will be required to meet with their individual therapist once a week, so a weekly session of 50 minutes or so, while also partaking in a weekly 2-hour group sessions with co-facilitating therapists. And it's during this group session that the skills are taught, and then you go and you practice them by yourself during the week, and they're also reinforced by the individual sessions with your therapist. But the 2-hour group sessions is really, it's not therapy where you get to talk about all your problems. It's more about learning these core skills, talking about what they look like, how to apply them, and then going out during the week and doing them. The group sessions are divided into 4 modules. So we have mindfulness, interpersonal effectiveness skills, emotional regulation, and distress tolerance. And each one of the modules takes anywhere from 6 to 12 weeks to complete, depending on the program that you're following. Although there are technically 4 modules, typically mindfulness is taught during the 3 other modules. So those partaking in the treatment will typically do 3 modules over the course of 6 months. So starting with either, let's say, interpersonal effectiveness skills, and during this module, they learn mindfulness. And then during the second module, they learn emotional regulation, but also they're going back and they're learning more mindfulness. So it's kind of sprinkled over the course of the 6 months rather than having one chunk of 6 weeks to learn mindfulness. They do it simultaneously. In terms of mindfulness skills, clients will learn 3 what skills, so observing, participating, and describing, in addition to 3 how skill, so non-judgmentally, 1 mindfully, so doing one thing at a time, and effectively. So how can we have conversations in an effective manner and get to the goal that we're trying to with our actions and our words? During the interpersonal effectiveness skill, as you may have guessed it from the name interpersonal, it's dealing with the relationship we have with others. During this model, the main goal is to help clients better manage relationships, conflicts, learn how to make requests and say no, and also eventually maybe leave toxic relationships. Clients are asked to practice assertiveness skills using acronyms such as DEAR MAN, which stands for describe, express, assert, reinforce, mindful, appear confident, and negotiate. So they're given acronyms to follow a kind of structure when trying to make requests. There's obviously other ones such as give and fast, which help navigate this sense of maintaining relationships while also maintaining self-respect when we're asking things from other people. Emotional regulation has for objective to help clients better understand emotions, their function, and also manage extreme emotions. And this module places a lot of emphasis on changing emotions through action rather than impulse. Clients will learn how to build mastery, so doing things that they're competent in to help fight those feelings of helplessness and hopelessness. They'll learn how to cope ahead with stressful situations, so learning how to plan ahead to better manage emotions, and also to take care of their mind by taking care of their body. So there's a great deal of emphasis placed on the basic things, making sure that you're sleeping well, that you're eating well, that you're moving your body, drinking enough water. So a lot of entanglement between physical and mental wellness. Lastly, the distress tolerance module's main objective is to help clients survive crisis situations, ultimately helping them accept reality as well as becoming free of this need to satisfy the demands of intense emotions, urges, and impulses. Over the course of the module, clients will learn skills such as STOP, which is an acronym which stands for stop, take a step back, observe, and proceed mindfully. They'll also learn skills to resist impulses such as using intense exercise or cold water to change the body chemistry and bring them back down to baseline level where they can then implement those other skills of mindfulness, emotional regulation, but it's to bring them back down to a level that they can actually function and process what's going on. Over the course of the treatment, clients are also taught other invaluable skills such as learning how to validate themselves as well as offer themselves self-compassion. DBT has been shown by research to be effective regardless of the person's age, sex, gender, race, ethnicity, or sexual orientation. With that said, the only way to know if DBT is the right treatment for you is to speak with a professional who is trained in this method. At that moment, they will look at your symptoms, treatment history, and therapy goals to assess whether or not DBT is the right fit for you. Having recently started the program myself, I will be releasing an update video after the completion of each module to give an in-depth analysis of what my experience was. So to make sure you don't miss those, be sure to subscribe to my channel, and if you haven't already and want to support this video, give it a like. Thank you so much, and I'll see you next week for another episode of On the Line.